Energy drinks have surged in popularity over the past couple of decades, aggressively marketed as quick solutions for boosting alertness, concentration, and physical performance. They often come in brightly colored cans and promise increased energy, mental sharpness, and improved endurance. However, beneath this appealing exterior lies a cocktail of substances, primarily excessive caffeine and sugar, that can pose serious risks to health, especially when consumed regularly or in large quantities. The adverse effects of energy drinks are well documented, ranging from cardiovascular problems to sleep disruption and metabolic imbalances, making them one of the more hazardous products in the modern beverage market. The most significant health concern with energy drinks stems from their extraordinarily high caffeine content. While a typical cup of coffee contains about 80 to 100 milligrams of caffeine, many energy drinks pack between 150 and 300 milligrams per serving, sometimes even more. This level of caffeine can overstimulate the central nervous system, leading to symptoms such as jitteriness, anxiety, increased heart rate, and elevated blood pressure. For people sensitive to caffeine or those who consume multiple servings in a short period, this stimulation can push the cardiovascular system into dangerous territory. High blood pressure is a known risk factor for heart attack, stroke, and kidney damage, and the acute spikes caused by energy drinks may exacerbate these risks. Furthermore, the sugar content in many energy drinks is alarmingly high, often matching or exceeding that of sugary sodas. Some popular brands contain 25 to 30 grams of sugar per 8-ounce serving, which translates to about 6 to 7 teaspoons of sugar. This excessive sugar load contributes to rapid blood sugar spikes, increasing the risk of insulin resistance, obesity, and type 2 diabetes. The combination of caffeine and sugar creates a temporary rush of energy followed by a crash, often prompting repeated consumption to regain the lost alertness. This cycle can lead to a pattern of dependence, as users find themselves relying on energy drinks to maintain focus or fight fatigue throughout the day. Heart rhythm disturbances are another serious danger linked to energy drink consumption. Studies have shown that excessive caffeine intake can cause arrhythmias, irregular heartbeats, that may be harmless in some but life-threatening in others. In people with underlying heart conditions, even moderate energy drink consumption can trigger palpitations, chest pain, or more severe cardiac events. There have been numerous case reports of sudden cardiac arrest in young people with no prior health issues after consuming large amounts of energy drinks, often combined with alcohol or physical exertion. This raises concerns about the safety of these beverages, especially among teenagers and young adults, who represent a large segment of the consumer base. Energy drinks also disrupt normal sleep patterns. Caffeine is a well-known sleep antagonist, reducing total sleep time, delaying the onset of sleep, and decreasing sleep quality. Poor sleep has cascading effects on physical and mental health, including impaired cognitive function, mood disorders, weakened immunity, and increased risk of chronic conditions like obesity, hypertension, and diabetes. The problem is compounded because many people drink energy drinks late in the day or in the evening, unaware of how long caffeine can stay in the system, up to 6 hours or more in some individuals, thereby interfering with their ability to fall asleep or maintain restful sleep. Additionally, energy drinks often contain other stimulants and additives such as taurine, guarana, ginseng, and various B vitamins. While some of these ingredients have purported benefits, their safety in combination with high caffeine and sugar doses is not well established. The interactions of these compounds can amplify the stimulant effects or cause unpredictable physiological responses, especially in vulnerable populations such as pregnant women, children, and individuals with pre-existing health conditions. Psychologically, reliance on energy drinks can foster unhealthy behaviors. The perception that these beverages can replace sleep or boost performance may encourage individuals to ignore their body's natural signals for rest and recovery. This can lead to chronic fatigue, increased stress levels, and burnout. Over time, dependence on energy drinks may mask underlying issues such as poor sleep hygiene, inadequate nutrition, or mental health problems, preventing individuals from addressing the root causes of their tiredness or lack of focus. For young people, the risks are particularly alarming. Adolescents and young adults often consume energy drinks in large quantities, sometimes mixing them with alcohol or other substances, which significantly increases the potential for harmful interactions and adverse effects. The developing brain and cardiovascular system are more susceptible to the negative impacts of excessive caffeine and sugar, potentially leading to long-term consequences such as hypertension, anxiety disorders, and addiction-like behaviors. In summary, while energy drinks may provide a short-term boost in alertness and energy, their regular consumption poses serious health hazards. The combination of high caffeine and sugar content can cause elevated blood pressure, heart rhythm problems, sleep disturbances, metabolic dysfunction, and psychological dependence. These risks are particularly acute in vulnerable groups such as youth, pregnant women, and individuals with pre-existing health conditions. Considering these dangers, it is wise to limit or avoid energy drink consumption and instead prioritize natural methods of maintaining energy and focus, such as adequate sleep, balanced nutrition, regular physical activity, and stress management techniques.